The opinions and statements made by the guests of the Success in Practice podcast are their own, and I do not endorse or accept responsibility for their positions. Any information given by myself or the guests is educational in intention and not to be taken as medical advice. If you choose to act on the content involved in the podcast, you do so at your own risk. Okay, everyone, welcome back to another episode of the Success in Practice podcast. I'm Sammy Karam, and today I'm joined by Natalie Moore. Natalie is the founder and primary practitioner at Moore Pathways, and she has nearly 2 decades of experience as a manual health practitioner. She holds a research master's degree in dysfunctional breathing and has extensively pursued professional development in functional breathwork and integrative breathing therapy. Throughout her career, Natalie has dedicated herself to learning from leading researchers and esteemed practitioners across various fields, including breathing, dental, craniodental, women's health, and pediatrics. She sees a diverse array of issues ranging from neck, head, and jaw pain to sleep disorders, breathing dysfunctions, chronic ailments, and complex musculoskeletal complaints across all age groups. In addition, Natalie has expanded her expertise to assist infants of all ages, addressing concerns such as breastfeeding difficulties, reflux, colic, gastrointestinal issues, respiratory challenges, and developmental milestones. Natalie's therapeutic approach is characterized by its gentleness and efficiency, employing indirect cranial osteopathy, intraoral techniques, myofascial release, soft tissue release, joint articulation, and specific functional balancing techniques that prioritize mindfulness and precision. Notably, she refrains from employing joint manipulations or sharp joint manipulations in her treatments. Natalie, thank you for being on the podcast. I know we've been trying to do this for a couple of weeks now, and finally we're here. So I really appreciate you taking the time to join me today.
Pleasure. Lovely to be here. Thanks for having me.
So as always, this is one of the things that interests people a lot. We want to get to know a little bit more about you, Natalie, get to know your backstory, your early influences, tell us about you growing up, and then obviously going to school and getting into osteopathy and what led you to osteopathy. Give us a little backstory about you and who you are, Natalie.
Okay. I guess I grew up in Southwest Sydney. I guess the most notable thing that started me on the path that I've taken, especially with my kind of niche interests within healthcare, is getting orthodontics as a teen. And it was that orthodontist that said to me, you'd be much prettier if you breathe through your nose. So I think I must have been maybe like 14 or 15 getting braces, and having an orthodontist say that to you kind of like gets you thinking, well, what does that mean? So I started thinking about breathing very early on. I had a yoga teacher come to my school in high school and give a bit of a lecture and take us through some yoga. And that definitely piqued my interest as well. And that kind of started my journey in that. But I was also, a daughter of my mother, who pretty much led us with natural therapies, took us to the chiropractor a lot. So my upbringing and those sort of influences as a teen kind of got me into kind of natural therapies, and I think I just gravitated towards using my hands for some reason. I don't know why, but I started off doing remedial massage straight out of high school because I wasn't very academic. So I kind of dropped out of most of my classes in high school. So I wasn't a very academic kind of kid. So I went and did remedial massage, which actually was one of the best things I've done because, it gives you, it was a year diploma. It was very in depth. I learned a lot of anatomy from that course. And also, it got my interest deeply in fascia. There was a lecturer there that was very much into fascia, and so I kind of took that and ran with that. And then I went and started working with physiotherapists and doing all the kind of women's health and the Pilates things with the physios. And I decided to be a physio. And this was when I was down in Sydney at this point, and I was working at I think it was called the Cook and Phillips Centre. It's this huge, like, pool where all the Olympians used to practice. And there was a gym there, and there was a little physio. And I used to do massage and reception there. And I used to do kind of help the physios. Um, and so I got into doing physio in Sydney, and I said to the physios, "Oh, but you guys aren't doing it right. I'm going to be a physio, but I'm going to do it like this." And it was the physios there that said, "Well, that's actually just osteopathy. You might as well go do that." And so I ran away from Sydney and I moved to Byron Bay because I really didn't like Sydney. I wasn't thriving very well there. So I went to Byron Bay, and I think my housemate at the time was studying osteopathy. And I'd never seen an osteopath or anything. So I just decided and I think just listening to him speak, I was like, that sounds kind of what I'm into. So I enrolled and I got in, and because I got in as like a mature age student, I was 22 years old. And I remember, I started mid-year. So I did 6 months of lectures before I actually started osteopathic medicine. So I think I did like nutrition or something, I forget. But I started mid-year. So then 6 months of uni, and then I started osteo. And I remember my first osteopathic lecture, and I remember just sitting there going, "Oh, this is everything. This is everything I've been waiting for." Because I'd done so much reading on holism, and and even learning it back about the body for massage. They really taught how connected the body is, and so I really that was something that I really latched onto as a concept, and for it to be presented in osteopathic medicine, it was really what I was waiting for. So yeah, that's kind of my backstory in a nutshell, I guess.
Right. Okay. And so, who was it in that first lecture that you were listening to that really kind of caught your ear and made you
Oh,
quite passionate from the get go?
um, I have no idea. I can't remember. This is so long ago.
And
Yeah, I've got no idea.
this was at Southern Cross University,
Yes, Southern Cross in Lismore. So whoever that
right?
was,
And what year was that, Natalie?
that was my first year. It might have been Paul Oric, maybe? I can't remember. I have no idea. I can't really remember too many people's names, honestly. I'm bad with names, but
Mm, okay,
yeah.
so all right, well, okay, so going on from massage therapy to working with physiotherapists to then them telling you that what you're doing is more osteopathy. My question to that is, what is it that you were doing in front of the physiotherapists that didn't seem like what they would do, and like what is it that you
I
were doing there that
was
where they said to you, "Oh
very
no, that's osteopathy. Go and do that."
There was a very specific, and I remember it very clearly actually, because I was so into doing body work at that point. And so they would include me in the in services that they would have. It was a small kind of clinic, and they were very women's health based. So there was only, I think, about three or four physios. And so, as we do, we get together and we talk about a case, or they might have a patient that's not quite responding or getting better. And there was a patient who had something, I can't remember the specifics, but there was something wrong with this patient's elbow, and it wasn't getting better. And they were going through all the elbow things. And I said, "Why are you like going on about the elbow? Like, have you checked the shoulder? Have you checked like all these other things? Have you checked this? Have you checked that? Have you checked like, the thoracic outlet?" And they literally said to me, they're like, "Yeah, no, we don't do that. That's not what we do. We we do elbow stuff
Right.
if they've got a bad elbow." I was like, "All right, that doesn't make sense." So that's kinda how it
Okay.
happened, I guess.
And so, okay, okay. Well, take us back to your time at Southern Cross University. What was that experience like for you? You said that obviously the first taste of that was very, I guess, rewarding, and it was like you found your home in terms of healthcare. What was the rest of the experience of doing an osteopathy course at Southern Cross University? I mean, was it everything you expected it to be? Were there any ups and downs? Were there things that now in hindsight you wish you had more of? Things you had less of? What is it? Tell us about your experience at that institution.
Um, uh, well, I don't think I had any expectations about uni. As I said, I wasn't a very academic person. So if I was struggling with something, I just viewed it as that's just me. I'm just a bit of a dummy. Um, so I don't know, like uh, those days in my life, there was a lot of health issues I had that I've now overcome, and that's where I do a lot of the work that I do now. Um, so I think personally, in a personal sense, in a mental health sense, I really struggled during uni, um, and which affected probably my academic ability. So I wasn't a very, I wasn't getting top marks or anything. I was far from that. If I was passing, I was really happy. Um, but it was really challenging. I found the content really challenging. I found what we studied to be incredibly in depth. Um, I remember leaving uni and just even as like a first year new grad and talking to kind of other professions when you start to do that and realizing how much we were learning things and how in depth we were learning things. So, looking back on my uni days, I don't look back on those days and think too much about uni. It was more kind of like my chaotic personal life that I had at that point. But I studied with such great people. There, I had a really great group of friends um, around uni as well. And, I was living in Byron Bay as well. So I was having a great time in a
Hmm.
sense. But in terms of the uni, I don't know, like I guess I remember other people kind of having a problem with like things or whatever, but I didn't. I thought it was all great. I remember our masters and we had such incredible speakers come and do our master classes. I thought it was amazing.
Mm.
I loved it. Yeah, looking back, I still think I'm like,
Right.
wow, that was
So who've
such an
been? Yeah, yeah, great. I'm really glad you had that experience. Looking back, now that you mention it, who was it that you remember? You said you did some master classes and people came in. Were there any
yeah.
notable people that you kind of that really have stuck in your mind that you really appreciated when they came and spoke, or any of
Oh
your
yeah.
your actual lecturers or the people that taught you the content? Do you have any people that were quite influential to you as a young
Oh yeah.
practitioner, I guess?
Yeah, with our master classes, I think, well, Rosalba came in and did the breathing stuff. We had George come in. We had, I think John Smart might have come in and did lymphatics. Um, Shani McCook did pediatrics. Um, I'm just trying to remember. There was another. Oh, I can't remember his name. I'm terribly sorry. Like he only passed away a few years ago. He was incredible and very well known, very well loved. And I also did observations with some incredible osteopaths, Jeff Ward down in Sydney. I did a bit with him. Oh, some of our supervisors were great. I had Jonathan Evans as one of my supervisors, and I feel like I learnt a lot from him. Um, Yeah, I had Julie Streckfest as one of the lecturers. She was amazing. Yeah, we had lots of cool people come and teach us.
Yeah, good. Sounds like you had a great experience, and that you're able to at least get a wide array of opinions and thoughts and kind of philosophies on osteopathy. So that's good. And so, what year did you graduate, Natalie?
Oh, I don't know. What year did I graduate? 2000, 2015, I think. Yeah, because this will be my 10th year. So 2015.
Right. So 2015, and then you get out there and you're a right. So as a young practitioner in 2016, for example, or 15,
Yeah.
tell us about that. Where did you go after university? Where did you work? What did you do? What was your thought process around that time? You know, how am I going to get into this industry and actually start working? Tell us about that time of your life in terms of what you're doing around osteopathy.
Well, I moved to Brisbane specifically to work with Shani McCook. She'd been mentored by Maxwell Fravel and she did the pediatric course for us as well. And I think I just kind of made contact with her because she had done one of our lectures and she was trying to start kind of like a multidisciplinary clinic. She was doing a lot of pediatrics. I was really at that point interested in doing women's health stuff, as well as learning pediatrics. So I went and worked with Shani and did a lot of CPD in women's health stuff, which was amazing. And also sat in with Shani for the year and was mentored in pediatrics and learnt everything from Shani. And it was, I don't know, just kind of all was pretty organic with that. I think I had a few decisions on where I wanted to go. I had been offered something by Jeff Ward down in Sydney. But at that point, I think I really wanted to I think I had like, a boyfriend that lived up near Brisbane as well. So I just sort of chose to live in Brisbane rather than Sydney. But I also really wanted to lean into the women's health space, and Shani had a lot of networking and contacts with that, as well as the pediatric space as well. So yeah, I kind of just went along and did that. It was kind of pretty funny actually, because the clinic that she opened was like a Queenslander in New Farm in Brisbane, and it was kind of like a duplex, and then it had a granny flat out the back. So like one half of the building was a clinic, and I lived in the other half, and Shani lived out the back. So it was we kind of just like lived and worked there and had a funny time. So that was kind of fun. That was good. And then
That must
Shani
have been
got
a good
pregnant.
culture there. You guys, right,
Yeah,
right, right. Yeah,
great
that
time. So
makes it a
Shani
bit harder. But
went, yeah,
yeah,
yeah. Yeah,
yeah,
so she went
that
ahead
sounds
and
like it would have been a good time. Like I said, and so how long were you there for? And then, I mean, how what transitioned you from doing that to, I guess, being out on your own or doing your own thing? You know, what was that transition like? And yeah, tell us about that time.
yeah, so as I said, Shani got pregnant and went on maternity leave. And at that point, I think I'd been out potentially a year. And I'd sat in and watched her a lot. But we couldn't really find another osteopath to take over the pediatric list. So I kind of got thrown in the deep end and started treating peds my second year, while Shani was on maternity leave, and plodded along like that. And then Shani got pregnant again. And so it just got to a point, I think, where she was moving somewhere, and so the clinic wasn't going to continue. Um,
Right.
so because of that, I had to kind of look elsewhere. But I don't even know why I decided to go out on my own. I think I just felt like I could. So I just ended up, well, actually, now I remember, I ended up hiring a room, renting a room, and just starting my own, built my own website. But I had quite a contact with a functional dental clinic in Brisbane. And because of the masters that I did in with Rose Alber as my supervisor in dysfunctional breathing, so I kind of incorporated breathing into a lot of what I did. And so I kind of linked up with these dentists, and I think the room that I was renting fell through, like the zoning changed. And my friend who worked at the dentist, who I did a lot of collaboration with, she sort of said, well, just come and move in here. So I moved in with the dentist and just ran my own kind of business out of a room in the dentist's. So it all just sort of, that's kind of how my life works. Things just kind of happen for me how they
Just
should.
work out
So
for you.
yeah,
You're like even Steven. Things just work out for you.
exactly.
Yeah, yeah. So I want to take you back to that time when you were with Shani and as a young grad or as an early graduate. Did you have any problems in terms of patient numbers? Like, what was that like? Trying to get your numbers up, trying to kind of make sure that you get enough patients to kind of make a living. Was there any issue with that? Was that something that you
Yeah.
found pretty easy, or did you have some
No,
roadblocks there?
yeah, it was tough. And I think looking back, um, so Shani she went in and she was just doing pediatrics. So she handed on her adult patient list to me, but it wasn't um, a lot. But it's so hard to say because I remember it always being a bit of a problem. Like, I remember always feeling like, oh, I'm not seeing enough patients. What can I do? I was out doing as much networking as I can. I was, make through Shani as well. We were making a lot of connections. I made really great connections with the dentists. So I did a lot of networking. At that point as well, I think I was doing I was making brochures. I was going to events and things. But I think unless you walk into a very big, busy, structural based clinic, um, I think walking into something niche is, you're not going to get a lot of patients to begin with. And it just took me time to build and to build my confidence. Like, I was already very confident as a massage therapist. So I was confident in sitting with the room and doing body work, but um, wasn't confident in, following in the footsteps of someone who was very well regarded and, and patients expected that sort of treatment that they'd already had. So kind of learning how to find your own style of treatment and then build your patient list from there. So, yeah, I think those first few years were a real struggle to get numbers up. So, um,
Mhm.
yeah, I think honestly, yeah, it's a tough road to build a patient list. You kind of just got to be around for a
Yeah,
while, I think.
it is
Yeah.
definitely. You do. You've got to be around for a while, and I think someone also said a lot of it's not just skill set; it's also a bit of your personality and your charisma, and having that confidence that kind of shines through. People kind of gravitate towards that, and then they'll give you that
Yeah.
extra, 2 or 3 sessions before they pull the plug, and that could be what you need to just get the result for them, and then that kind of kicks you on. So. Um,
Yeah.
so yeah,
Even
no,
being
I understand what you're saying, and yeah, um, yeah,
Yeah, just being confident to actually
yeah. Go
rebook
ahead.
patients well.
Yeah, was that something you struggled with, or was that okay for you?
I think it was something that I struggled with. I don't think it was a natural thing for me to naturally just tell people, okay, I want to see you next week, or I want to see you in 2 weeks, or I didn't have the confidence
Mm.
to even know if I should book them in again or if they needed to. So yeah, I think now at this
Right.
point, you just rebook them. You just tell them when they're coming back in and you rebook them. Um, but as a
Yeah.
new grad,
Well,
it's a
I'm
tough
interested in
thing to do.
that. I'm interested in that, Natalie. So tell me more about that. So you found that you just either didn't know why or that they should be rebooked, and so you found it a bit of a struggle to actually get patients to rebook. Were you ever were you ever like either at university or through any kind of mentoring, like shown any kind of treatment planning? Was that something that you did? I know it seems like that you were working in quite probably a non-structural clinic, probably more biodynamic, and that's fine. But even really good biodynamic practitioners and people that do breath work and so forth, they tend to kind of still know how many sessions a patient should really need to start to see some changes, and then you can kind of put together a treatment plan. Was that something that you were either shown at university or that you were shown by a mentor, or was that just something you had to learn on the fly?
We weren't really, I didn't learn biodynamics, but we were, treating pediatrics, so it was cranial, but I was also treating adults. So I was never a
Hmm.
strong HVLA person, but it was still structural approaches as well as indirect approaches. Um, probably I was
Right.
taught at some point. I don't remember if I was or I wasn't. I remember certainly learning from Shani a bit more of a treatment plan for babies. But for adults, I think you have this, well, I did
Mm.
certainly as a new grad, feeling
Mm.
like I had to make them better in the first treatment. And if I didn't get them completely better, and if they didn't kind of just feel so great, then I just kind of didn't have the confidence to tell them to come back. I think I always wanted to just leave it up to the patient, um, which, again, I think it's just learning um, and kind of collecting your data, your anecdotal data as you work for a few years. Um, I actually remember I did an online course, one of Jonathan Evans' online course about that, about rebooking patients and about the language to use. And I remember that helping me quite a bit, um, and knowing kind of, yeah, just learning about a little bit more about the treatment process and how to feel a little bit more confident with taking charge with patients and letting them know what to expect. And I think that was just a confidence thing as well. I think it took me a few years to um, feel okay about that and to, stop over treating and trying to do everything in one session. That took me quite a few years to stop doing, actually.
Yeah, yeah, definitely. Hello, everyone. I'd like to take a quick moment to thank everyone for watching and listening to the podcast. If you have received value from this episode, the kindest thing you can do for me is to like, share, follow, and subscribe to the channel on whichever platform that you are listening on. If any of the conversations have resonated with you and you feel that I can help elevate your practice, you can find me at successinpractice.net. That is, the Success in Practice program can be found at successinpractice.net. The Success in Practice program is the signature program that takes a practitioner who may be struggling with retaining patients. They may not be certain about building effective treatment strategies, and they may feel somewhat anxious and doubtful about what they are going to do with a patient, and they are not really accelerating in the real world of private practice. It takes this practitioner and it turns their careers right around to the point where the patients have an effective diagnosis and a real treatment plan that they can take home. Patients are happy to book in multiple sessions with you, and they are confident about your abilities. And more importantly, you now have direction and are confident about your own abilities. The program streamlines how you operate as a practitioner. Guys, you should have been taught this at university, but you weren't. You may have been practicing for the last few years thinking there has to be a better way. There has to be a more effective way of engaging with patients and getting them results. Well, there is. And this is what the program delivers. Go to successinpractice.net and check out the options available to you. See where I can help you easily grow your patient list and finally earn the rewarding income that you deserve. For all the information on how you can reach me personally, check out the show notes. Also, in the show notes, you'll find a link to the chat transcripts from these podcasts. These are valuable and a wealth of information. I really hope that you're enjoying the podcast. Guys, leave a comment if there's any questions on this episode. And please don't forget to like, share, follow, and subscribe to the channel. Now, back to the show. Okay, so tell us about your professional development post university. When did you start working towards the field of practice that you're in now, and kind of do a lot of the things that led you to the masters with Rose Alba?
So the master's was just the Masters of Osteopathic Medicine, and that was supervised by Rose Alba. So we focused on dysfunctional breathing then. So that was just part of uni, but it was kind of serendipitous because I was already very much interested in breathing because of kind of what happened in my teen years. But the first year out of uni, I did a lot of CPD from the first year, really, and I haven't stopped since then. The first year, I did a lot of women's health courses. One of the first courses I did was with George Stillion, Julie Fendel, and Sue Turner in women's health, and that really stuck with me, and I still have the notes from that course that I refer to often. I did a lot of every year I do a lot of CPD, and I think especially now in the last few years, working with the dentist, so I've done a lot within the craniodental space, a lot of extra courses there, not just osteopathic, but all sorts of things. But I did one of George Stillion's craniodental courses, and that was amazing. I think he's got another one coming up in May, actually, that I'll be helping out at. But yeah, I just, every year I think every year I try to do at least one big course. One big osteopathic course, but I do lots and lots of smaller kind of short courses. I think I've got 3 online courses going at the moment. It's just constant. I don't stop, really.
Great. No, that's fantastic. I did the structural cranial course recently with Lisa DiStefano down in Melbourne, and so that was very good.
Yeah, I heard it was amazing.
So I would encourage you to do that. That's I think she might be back there next year. So that's one of John Marshall's things. He brings out Lisa, I think, on a yearly basis, and if you get a chance to do that, she's amazing. She's really good to listen to, very inspirational too. Yeah. Okay, so you're doing a lot of work now in the orthodontal space. Tell us about working within I'm assuming you still got a room within that dental clinic, is that correct?
No, so I left that clinic about 4 years ago and opened my own clinic,
Right.
which I've now closed. So now I'm just renting a few rooms in a few different clinics.
Right, but you've obviously, I think, set up really good networks with the dentists that you've gotten to know. Is that correct?
Yes, yeah, I work
Right,
quite
and
closely.
yeah. So tell us about some of that work. Like, what is it that you're seeing post dental work, or what is does the dentist send you people saying, look, I've had a look at them. This is not a dental issue. Can you have a look at this? Or they've had some dental work and now they're suffering from this, and see what you can do. They are the kind of presentations that you're seeing?
Not necessarily. Most of the patients that I'm seeing referred from the dentists and the orthodontists are patients that are going through treatment. So they might be having expansion, they might have a splint, they might have TMD, they might be having sleep problems. So the dentists just know that this patient will benefit from an interdisciplinary approach, or they've identified that this patient might have a breathing dysfunction. Um, I Yeah, so it's not that we work together. So it's not really that, all right, I've done my job, now go see Nat. It's more a collaborative effort that we work together, especially with the tongue ties. So
Right.
um, I work with the myofunctional therapist, so the patient will be seeing myself along with the myofunctional therapist. They'll have a consultation with the dentist. The dentist might refer them further for ENT or for a sleep study. And then we kind of, and because we've built relationships rather than, just writing reports here and there, we talk directly to one another.
Mm.
So it can't just be on a WhatsApp group. So, and we get together and we hang out. So it's easier to chat rather than send a report
Yeah.
sometimes. Um, but yeah, no, we work pretty closely together in a collaborative sort of effort. But I do have other dentists within Brisbane, but all over really, that people come. And sometimes they are, yeah, they've done their job. They might have TMD, they've done their splint, and they're not getting quite as much relief as they want. And then so they might go, oh, well, maybe you should go see an osteopath. So there are some dentists that I don't necessarily really work super close with, but they've heard of me. And so then they'll refer. So there's a few different avenues that it kind of happens from. But I think in my close group, we work a little bit more collaborative in a
Yeah.
collaborative.
Okay.
Mm.
And is it are you finding that the work that you do from, I guess, with the in the orodental space, is it leaning itself more towards, say, a cranial approach? Does it lean itself more towards a myofascial? Do you use a mixture of things that you do? Where have you found that you're getting the best results for patients in that field?
I would say a mixture. It's not really about what one technique or approach works the best. And I guess the only way to really find that out is by doing a study. Um, but it's really about, like, I think all osteopathy should be about, is about matching an approach with the patient. And I think that's why we have such a broad range and broad tool bag of techniques, is
Mm,
because um, we're not kind of one trick ponies. So
mm,
it's not really about, okay, well, I've decided that, cranial is the best for this, because it might necessarily not be, So, um, no, I try to address all factors, and sometimes it might be a more cranial approach. It really depends, because I work with people who are very chronic, complex, highly sensitive people. And in that sense, doing a HVLA on a neck is not going to be great for them. So they might need a little bit more of a cranial approach. And cranial can be direct as well. It doesn't
mm.
just have to be biodynamic, but sometimes people respond really well to biodynamic if their nervous system is ramped or something like that. Other people need a lot of fascial work, and I'm really getting into a lot of the fascial research that's happening at the moment, especially within the women's health, because I'm still really interested in women's health. And TMD is really a women's health problem, and there's a big kind of dysfunctional fascia that happens, especially around women's hormones. So working with fascia in that sense is really important. So it's very individualized, and I think a lot of people who reach out to me and want to talk to me about how I approach certain patients, and every time I say it's just osteopathy, you just treat what you find. The only real difference that I have is that I have the language. I speak the same, I know the language of the dentists and the myofunctional therapists, and um, that's the only thing that's different with me. In terms of my treatment, it's just osteopathic treatment. So
Mm.
it's still, you just treat how you're going to treat that patient.
Yeah. And so you in your time doing a lot of the professional development that you've done, have you found that there are other people outside of osteopathy that are kind of seeking that particular knowledge? Like, do you have chiropractors and physiotherapists and so forth?
Oh yeah.
Yeah. And
Yeah.
so how do you find that your thought process, I guess, differs? Like, do you find that you do you think about things differently? Do you when you converse with people, do you find yourself kind of thinking a bit differently or thinking on a different level to the way they're thinking? I'm not saying one's better than the other. Just that is it different? Do you find that difference?
Yes, that's a really good question because within this field, chiropractors are very interested. Chiropractors are doing a lot within this field. Um, and I think, I hold a bias because I'm an osteopath. So I just think we're, so wonderful. Um, but and I don't know if I should say this or not, but in my
No, no, go
experience,
ahead.
in my experience, we are kind of superior. Like, and I think I started off doing this sort of work right from the first year, right from new grad. And I was very unsure of myself. I really, really didn't know what I was doing. Um, but the team that I found myself in, the dentists and the myofunctional therapists that I'm still working with, I would be like, "Ugh, I don't know, I'm just like a new grad." And they're like, "No, you know so much. This is incredible." And you do leave uni knowing so much and so much anatomy. And I don't think any of the other professions learn the in-depth kind of way that we learn. So yeah, I've worked alongside a lot of other professions, and not only do we have sort of a lot more knowledge about the anatomy and the way that the anatomy works, but also I think the way of thinking that is taught to osteopaths is not something that you can just it really is an osteopathic approach. It really takes like an osteopathic brain and mind to address and to see some of the patterns that are happening in these sorts of fields. And I think that the other professions find it fascinating and they really want a piece of that pie. And I've had to really check my bias because I have met some really amazing chiropractors. Um, but I am always like, if I meet somebody at a course, or if I'm speaking at a course and there's chiropractors there and they come up and they're like, "Oh, I'm treating much more like an osteopath." And I'm like, "Sure." So I kind of got to be a little bit nicer. And you know what? At the end of the day, there's a lot of people in this space, like the airway space, the pediatric space, and the craniodental space, and they genuinely want to do good work for people. So, and there's a lot of very smart, interesting. I met a physio the other night at a networking dinner, and she did a master's in orofacial pain, um, and she had so much to bring to the table as well. So I have had to learn how to check my internal bias towards other practitioners, and um, yeah, and collaborate a little bit more with them and let them kind of come into the space a little bit. But at the same time, I'm very protective of it as well. So
Hmm.
I think there's a lot that osteopaths bring to the space, and I think that we do it very well, and I think that it would be best if we are at the forefront and the forerunners of it as well.
Right. So, okay, following on from that question, and obviously following on from that answer that you gave us too, I'm going to ask you this question. What is an osteopath? Define it for us. I mean, what's osteopathy? You said you mentioned a few things there about it, to think like an osteopath and the osteopathic approach and the osteopathic rationale. Can you define that for us? Can you tell us what that is? I've asked this to a lot of other people on the show, and I'm just interested in what you think osteopathy is. How do you define it?
Oh, this is a left of field question. I didn't know you were going to ask that. And I think it depends on my mood as to how I answer that. Because people ask me, I was at this dinner. I had a networking dinner with a orthodontist, and he works with chiropractors. There was a physio at the table, and they're like, "Well, what's the difference?" Um,
So
and
your
I
your response when you're a little bit pissed off is a little bit different than when you're when you're nice in a nice
Yeah,
mood.
after a few
Right.
glasses of wine,
Well,
or
hopefully we've
like if
caught
there's
you.
other osteopaths at the table.
I think I've caught you in a nice mood. I hope I've caught you in a good mood. Tell us what. I mean, look, I know that. I mean, I don't mean to bring anything out of left field, and it's not. But I mean, you are an osteopath. I could ask you what an osteopath is and what an osteopath does. So tell
Yeah.
us, give us your answer to that.
I think fundamentally, the thing that sets osteopathy apart from other manual health therapists is our palpation skill. And I think fundamentally we are holistic. And I think the word holistic has been kind of dragged through the wellness kind of mud a little bit. And I don't think people use it properly. But I think in a philosophical sense, holism is at the core of what we do. And um, I think that's what osteopathy is holism.
Right.
Um, and then, I think if I was answering that like to the dinner the other night, kind of trying to discuss the differences between an osteopath and a chiropractor, I might kind of bang on a little bit about that, and how the chiropractors have a different sort of philosophy or conceptual sort of thing. But yeah, I think
Would my therapist argue with you on that about palpatory skills? I mean, my therapy is predominantly hands on. They have good palpatory experience, and based on the amount of people they would see, they could argue that a really good myotherapist would have just as much palpatory sense as an osteopath.
yeah,
You mentioned also the sorry, it just got a mind blank. You mentioned the palpation and also the holism. And so, could you get a myotherapist that could palpate really well and think holistically and kind of share that same space that we do? Is there any more to an osteopath than just that?
I think that, and this is speaking from my background in starting off as a remedial massage therapist, and what I used to do was pretty on par with what a myotherapist would do in terms of how much fascial CPD work and extra work I did as a massage therapist in the remedial space. And back then I had very good hands. I had very good palpation. I was able to hone that palpation that I had learned into an osteopathic palpation. And I think the sense of palpation that we sit with in going beyond the fascia and beyond the muscle, um, and refining that palpation, I think, I and using that palpation and marrying it with our knowledge of anatomy changes what palpation can do. So with that palpation, it comes with a background of anatomic osteopathic knowledge and awareness that I don't think any other manual therapist is able to have. And sure, if they sat with an osteopath and learnt these concepts and learnt the principles of osteopathy, then I think they could hone that palpation because they already do have that sense. But I think a palpation in an osteopathic, what the background of osteopathy brings to that is has a lot more depth than just having good hands that can feel muscle and fascia.
Right.
Um,
Could you be an
yeah,
osteopath without palpating? I mean, there's a trend now in terms of
no.
practicing telehealth and giving out advice. I mean, if I was sitting down now and me and you were one of my patients and we're having a little telehealth consultation and would I be able to think in a way that would be able to give you advice about your lifestyle that would be osteopathic? Would that be considered osteopathy?
Mhm. Yeah, of course. And I think that how things changed from the pandemic and we were able to sit online, and I've done online telehealth with breathing and stuff like that. But
Mm,
I think the ability to do that in a really good way comes from the experience of palpation
mm.
and the experience of being with bodies and feeling bodies. And I think we would be able to do that with our background in that. So, yeah, I mean,
Yeah, I like that answer.
mm,
Yeah, that's great. And I guess then it would be a shame if the things that you mentioned about a really good deep knowledge of anatomy and palpatory experience were to be, I guess, stripped away from our education. I think that you mentioned that. I mean, we've been talking about your university time and so forth, and you really appreciate it. And you've mentioned this a couple of times in our conversation, how you felt there was a really good, deep understanding of anatomy and physiology, and that was one of the differences that you found between other professionals. And so that would be a real shame if that became diluted down within our university courses, and also the palpatory sense of it. Are you seeing the same level of education amongst, say, the graduates that you're seeing now come through to you? The people that are working with you, are they kind of having that same knowledge level, or do you think things are kind of just we need to be a bit more aware of not letting that slip?
I don't know. I don't know if I've had too much of a experience with new grads. One of my colleagues that is working with me, who came out of uni, I felt like her knowledge was amazing.
Mm.
Um, her um, her notes were incredible. Um, and her anatomy was great as well. I was super impressed by her. I think
Yeah.
she's amazing. Um, and I've met a few other students have come through for observations, and a few others recently joined us on a study group. Um, and I don't know, like I think they're all really into. I'm not really quizzing them on their anatomy,
Mm.
so I don't know. They're probably better than me. I'm I'm not that great at it, to be honest. But um, yeah, I don't know. I guess so. I think you'd have to ask them. What?
Yeah. Yeah, but it would
Yeah,
be like, I mean, it's been one of the things that really sets us apart. So it'd be good to make sure that that standard stays in place.
you'd hope so. Yeah.
Yeah, I want to ask you about some of the challenges of running your business. You said that you did go out on your own, but then you closed that down, and now you work out of a couple of rooms.
Hmm.
What were some of the challenges for you that kind of made you say, "Look, it's probably best that I just work out of a few rooms"? Tell us about that experience of opening up your own clinic and your own business and having some of those challenges. What can you tell us about that time?
I think the challenge at the end of the day is that if you're the business owner and your name's on the lease, at the end of the day, it's up to you. So if you sign a another 5 year, 5 year lease, and the people who are working for you, you know, they move or they go off and do
Mm,
something else or they start their own businesses or whatever, um, it's back to you just working for
mm,
the whole clinic until you find somebody else. And I think the major challenge with starting an osteopathic clinic is finding osteopaths. And
yeah.
there's not many of us, and you know, quite frankly, it's going to be a better income if you work for yourself. So, and I think there's a lot of osteopaths that are just happy to have their own little clinic or already working in other clinics that they're really happy with. I was super amazingly lucky. I had two fantastic osteopaths come on board with me. Um, but there was just no guarantees they were going to stay with me because they've got their own lives and they've got their own paths. So I had to make the decision, well, do I want to kind of keep, because it was working really well. It was fantastic. But there was maybe another year or not even before I'd have to like start all over again and go find other osteopaths. And the other thing about having a clinic and a lease is that you're kind of stuck there. I wasn't quite sure what I wanted to do personally. I didn't know, maybe I wanted to have a little bit of time off or go overseas or something like that. And if you've got a clinic, you can't really do that, unless it's running really well and you've got people who are working there. Um, and so, yeah, I think that's the biggest challenge was, I was so lucky, but to then find another bunch of people and be lucky again and again and again with having great practitioners. I think that's the biggest challenge, really.
mm, mm. Tell us about the course that you did with Rosalba. I mean, I had a chat to Rosalba. I think she was episode number 2 on the podcast, and I was, when I sat down and I made a list of the people that I really wanted to have a talk to, she was in the top 10, and I find her fantastic, and I wish we could support her more. I think as a profession, because I think she's doing some fantastic work.
Yeah.
Tell us about your experience with her. What was the what were some of the highlights of learning from her? And if people want to learn about integrative breathing, what kind of experience should they expect with Rosalba?
Um, I think it was an incredible course. And if anybody ever comes to me and says that they want to, learn about breathing, then that's the course you have to do. You don't know what you don't know until Rosalba teaches it to you. And I don't know any other osteopath who has published as many papers as she has.
Mm,
Um, Her depth of knowledge within that field surpasses anybody else's that I've ever met in this industry. And being within the craniodental kind of industry as well, there's a lot of breathing and airway associated with it. And I go to study groups and talks and listen to surgeons speak. And Rosalba is like so far above most of them with her knowledge, and she's incredibly intelligent. So my experience was probably the same experience that I had in uni. It was just so much content and so much knowledge and so much research and so much work put into that course that she's written. And it was work. And at the end of it, you have to write I think it was 3 case studies to get accredited. And she's very supportive as well. Like she
mm,
wants you to succeed and she wants you to understand and she wants you to be a good practitioner. So, um, and I also kind of love her teaching style because it's kind of no bullshit.
mm-hmm.
She's very, you know, she's very direct with how she's going to teach you. So I I feel like I've written being becoming somebody with a reputation in breathing and the sleep and breathing space. I think it's her coattails that I've ridden the whole way.
Yeah.
exactly repeat what Rosalba says.
Yeah.
Um, and I'm a smart person in the room. So
Yeah, well, we're all like that with some of our mentors, where when you don't know something, you're just like, "What would Rose Alba do?"
yeah,
Yeah,
exactly. Yeah.
yeah,
And
yeah.
and the amount of content and research that is in that course, the integrative breathing therapy course that I did with her, I still like it's on my kind of, your the favorites thing on your
Mm,
thing. So I just always I can always go back to it. And it took because I think I would have done that about 4 or 5 years ago now. Oh gosh. And it took like a little while for it to kind of really get in and land. And
mm,
it's just really, and it's just such the breathing space. As I said, like I work within the craniodental, I'm doing the tongue tie stuff, I do babies, I do women's health, and a lot of chronic complex stuff. People with POTS, EDS, dysautonomias, really it keeps coming back to the breathing space for me, the
mm.
breathing in the airway. And Rosalba really kind of brings that research together in a really intelligent way. Um, so I think if anybody's wanting to work with breathing in any way, um, from whatever profession, you got to do that course.
Yeah, definitely. I would second that. You've done some work. Obviously, we've just discussed the work you did with Rose Alba. You've attended courses with George Stillian,
Yep.
Julie Fendel, I think you said, and a few others who have of great experience. If I was a new grad or an early graduate, and I'm looking out there to do some courses, whether I want to be a really good structural osteopath or a biodynamic or an indirect or a direct, it doesn't really matter. What is it that I'm looking for in a person who's running the course that would make me, I guess, willing to do the course with that person? Like, what is it about them and about their career that says to you that yes, this is a person that's the real deal, that they're not just kind of like, they just haven't been practicing for a couple of years and decide to sell something. What is it that makes them the real deal?
I guess reputation, for one. I think anybody who has published research as well is going to be someone has spent a lot of time in that space, thinking about that space, and putting the effort in to publish some research. Um, so yeah, I think it doesn't really matter what sort of niche space you want to go into.
Mm,
Um, I think looking at uh, yeah, the people who are publishing the research, quite frankly, um, and reputation. I think at the same time, once you start kind of getting into niche spaces, you start kind of hearing the same names over and over again, and you want to, even if they're not going to be that good, like it's really interesting sometimes because I've done so many courses just from like, oh, I've heard about this so much, and we'll see what it's about. And it might turn out to be like, this person knows nothing, but for some reason they're the voice kind of carrying it through. So it's really good
mm,
to know what are the voices within that space and how can you contribute to it? Where are the gaps in it? But to get the good courses, um, because there's some fantastic osteopathic courses that obviously they're osteopaths that haven't published any research, but they've got incredible reputations within the industry
yeah,
because
George
they've
Stillion's a good example of that. I think he hasn't.
like,
Yeah,
and he's been practicing for like 30 plus
over
years
40
as well.
years. Yeah, over 40 years.
Yes.
Yeah.
Like just doing a course from like somebody who's been an osteopath for 2 years or something, um, might give you some, that might be valuable in some way. But
Mm,
I think the real kind of gold comes from um, people who have really spent the time and the effort
mm,
and the research. And I think that's what osteopathy does really well. I think we really um, we get our elders within osteopathy and we put them on a pedestal where they should be. And
Mm. Yeah,
yeah, got it.
you mentioned reputation. I think also having a track record of actually doing the thing that you're teaching and getting
Yeah.
good results with it, I think is a major thing, right? Like it seems so obvious, but
Mm.
to like to learn something from somebody who's been doing it for many years, seen many patients, and had a really good and has a really good track history of actually getting results using the thing that they're teaching, and hopefully that they are still practitioners too. Like one of the things I think is that you don't want to be going to a course and taught by somebody who's just teaching courses. That's all they do now. They go around the country and they just you want to still see a clinician, someone who's a practitioner who's in the trenches doing the work, getting results, and then getting that real time feedback and then giving that to you. And if they run courses, those courses will continually get better. I'm sure Rosalba's teaching today is more informed than what it was, 20 years ago or 25 years ago when she taught us at university. University, when we saw Rosalba for the first time, she was on the fringe. She was really on the fringe. She was like, oh, we're like, oh, this is like, wow, this is. What do you mean breathing? Like, what? And now it's just like as if we didn't think of that. Who didn't? Like now you kind of to facepalm moment where you kind of go, as if we didn't think that breathing would affect, diaphragmatic function or shoulder pain or whatever it is that you're looking at.
Yeah.
And
Well,
so,
I
hello everyone. Just a quick break to give you some information on where to best find me. The first place is the private Facebook group called the Successful Practitioner Pathway. I've set up this private group as a place where practitioners can go and get tips and advice on how to best accelerate their practice and improve their clinical practice skills. The second place to find me is at successinpractice.net. That is where the Success in Practice signature program is housed. You can find more information about me and how I can best help you achieve success in your practice. So, the two best places, the private Facebook group, the Successful Practitioner Pathway, and successinpractice.net. I will link to both those places in the show notes. So, for more information, please see the show notes. Now, enjoy and back to the show.
I think we're in the space where I'm so surprised that osteopaths aren't more interested in sleep and sleep science.
Yeah,
I,
definitely.
like, well, that's like, we're so interested in the cerebral spinal fluid.
Mm.
Like,
Yeah, no, the sleep is definitely something. I spoke to Adam Nicholson on the podcast about a month ago or 2 months ago, and he said the same thing. Why don't we look at sleep and diet as being
yeah,
major things that we could really have an effect on? And yeah, no, so the people are talking about it, but until we get somebody that's going to really become an expert in that field, we get another Rosalba, but in the sleep space.
yeah,
Then I'm sure it's there for somebody. Um,
oh, trying.
yeah, definitely. So I want to ask you then, if you were to kind of have a magic wand, and I guess pave the way for yourself in the next 5 years of practice, where would you like to go? Like, what are you thinking of doing in the next 5 years? Where would you like your career to go? Are you happy just doing what you're doing now, or are you wanting to expand more into sleep, more into other parts of, tell us where you're going, Natalie.
Yeah, no, exactly. That's exactly what I want to do. I would love, and I say it often, like I would love to do for sleep what Rosalba has done for breathing. So my hope is just to start off with getting some published research, which is actually going to be in, around tongue ties. But if I had a magic wand and it was like I was allowed to do whatever I want, I would do my master's in sleep medicine. But not being able to take on any more hex debt and
that
having to just kind
would
of
that would be
get,
part of the magic wand.
yeah. So it was like if there was no more hex debt, I would go do my sleep sleep masters, my master's in sleep medicine. But because I can't really do that, I'm doing a lot of other CPD work within sleep, and I would love to marry sleep with women's health. So I'm trying to write a course at the moment, which is the importance of sleep and breathing within women's health, and really kind of look at all that research. I'd love to do some studies within that and write some maybe get some case studies published. But that's where I'm trying to take it. And I'm after closing my clinic, I'm trying to get some online courses up. So I'm taking more pathways more into an integrative online space, both for practitioners and patients, and also doing some within the osteopathic guided frenectomy stuff as well. So, but that's my intention, is to really kind of fill this massive gap that's missing in sleep and sleep science. And because you've got kind of sleep scientists and sleep physicians who are kind of looking at insomnia, they go straight to CPD, CBT kind of therapy, or it's CPAP or dental mandibular advancement splints. And on the other end of the spectrum, it's like sleep coaches who have like zero medical background
Mm.
whatsoever. And just like Rosalba kind of saw this big gap within breathing, and this functional approach to breathing, there's this huge gap within sleep as well.
Yeah.
And I'd really love to explore that a lot more. So yeah, that's where I'm really interested. That's the space I'm super interested in.
Right. So tell us with regards to sleep. Obviously, you're very interested in it. I'm sure you've already integrated it into your current practice. Would that be correct? Right.
Yeah.
So, for the osteopaths listening, what are some of the things they could do straight away in their clinic to learn more about how sleep would affect their patients? Like, obviously, I mean, I ask about sleep. It's in my case history. I ask a few questions about sleep. If how they rate their quality of sleep. If they feel like they're waking up in the middle of the night, those kinds of things, just to understand for me their recovery, their
Yeah.
capacity. It's really so sleep's obviously linked in with your capacity for recovery, and
Yeah.
so if we find that somebody's got really bad sleep, their capacity for recovery is not going to be as good, and the outcomes you're going to get isn't going to be, I guess, as linear as you'd hope. It's going to be a bit of a yellow flag, just kind of waving itself up there. Um, I mean, other than the advice that I would think about from a common sense point of view, I really don't know much more about sleep without
Mm.
doing a sleep study. And so, can you maybe bridge that gap for us a little bit? Are you able to shed some light on some of the things that we could ask about in a case history that would tell us if somebody's actually getting a good night's sleep?
I think the number one question to ask people if they're sleeping well is, if are you waking up feeling refreshed? Because you can say to someone, "How's your sleep?" and they'll go, "Oh, great." It's like, okay, how do you wake up? Oh, like shit, I feel
Mm,
horrible. Like, and it's like, well, then you're not sleeping right. A person can go unconscious for 9 hours a night, but that doesn't mean that they're getting deep restorative sleep and that they're going
mm,
into to slow wave sleep. And it could be disrupted for a number of reasons. And to understand sleep, um, you have to understand breathing. So to start understanding sleep science, because you can't sleep if you're not breathing.
mm.
And so you have to learn about breathing before you learn about sleep, I think, within our space anyway, unless you're going to be working as a psychologist with people with insomnia, then that's a different approach. But even so, I'd love for my courses that I dream of writing to be for psychologists as well, because I work closely with psychology as well. If there is anybody that's really interested in learning more about sleep, there's a really fantastic online learning called Sleep Well. I think it's sleepwell.nz maybe. But have a look. All of the top minds, one of Rosalba's,
Google
uh,
it. Just
yeah,
Google
just
it. Sleep well.
sleep well. And pretty much all the names, everybody who's doing work within this space has like a small, like a 1 hour kind of CPD
Right.
video presentation in there. And, there's TMD, there's sleep, there's orthodontic stuff, there's breathing stuff, pediatric stuff. So if you go through that, that would be a great starting point in learn. Even I think there's probably one in there that just gives you the fundamentals of sleep science. And so just learning about that will start you off somewhere. But if there's one question in your history that you ask people is, are you waking up feeling refreshed? And if the answer is no, then there's a problem with sleep.
Okay. Great to know. Good to know. All right. And I guess the final question I have for you tonight is I asked you about your 5-year plan in terms of what you want to do in the next 5 years, and I guess I hope you succeed with that because we'd love to just ride your coattails on sleep. um, but in terms of the profession, I mean, you're an osteopath and you seem like you're quite passionate about it. Where would you like to see osteopathy go in the next 5 years in terms of either some of the challenges that are ahead of us or some of the opportunities? Like, what do you see some really good space that we can get into? Well, you've already mentioned sleep, but are there any other things that you think osteopathy can exploit?
Yeah, like all the spaces, women's health, the sleep, the breathing space. Rosalba's already doing that, but I think there's so many parts that osteopaths have traditionally contributed to. And I think so much of our knowledge and our techniques and approaches have been taken from other spaces, and they're the people kind of doing the research. I think more osteopaths doing research. I know I want to talk because I haven't done any, but I'm not like a super academic person. So all those kind of like academic
Yeah.
osteopaths, um, if someone
Look,
wanted to help me do some research,
research is a
like
calling. Research is definitely a calling,
I
you
think
know.
so. And Rosalba talks about it a lot as well. But even within, because I'm doing a lot of functional feet stuff as well.
Mm,
Um, Osteopaths should be doing a lot more with feet, and working with podiatrists and, saving kids from being in orthotics their whole
mm,
life. So I think that space, the craniodental space, I'm kind of passionate about it because I'm trying to keep at the forefront of it so that the other spaces like chiropractors and that don't take over. Because I think that a lot of the functional way that dentists and orthodontists are thinking, I think, have come from osteopathic minds and osteopathic voices within that space. So
mm.
it would be just a real shame to not hold, keep out as many seats at the table in those spaces. There's so much more. I would love to see osteopaths in hospitals for pediatrics, in
Mm.
NICU with breastfeeding. And I know, pardon me, I know there's some people doing that really good work as well. So I think just with our kind of minds, I think we should be in almost every space, honestly.
Yeah. Speaking to Lisa DeStefano on the podcast a little while ago, um, she mentioned something about the osteopathic hospital over in the States. You know, there used to be this thing called the osteopathic hospital, and it would be just a whole bunch of osteopaths running a hospital, seeing all different things for all different people. Um, the last, I think, hospital closed down recently, so I don't think there are any left. But
Yeah.
that's a really good kind of place to think about. But I guess moving on from that. Oh, sorry. Before I let that thought go, you mentioned about feet. Um, little plug here. I've actually got a course coming up on the foot. It's called the Foot Unlocked, and that's coming to Melbourne, Sydney, and the Gold Coast. So we look at the biomechanics of the foot and its effects on lower limb injuries and lumbar spine injuries. So we're looking at the chain effect, the pattern recognition of the foot, and how it kind of breeds this kind of this pattern up the chain We look at things like closed chain mechanics and how it all integrates to the foot, the calcaneus, the cuboid and navicular and the talus, amongst other things. We look at different loading patterns and then how you can affect them as an osteopath. You talked also about orthotics and trying to get kids out of orthotics. I couldn't agree more. It's good to also have a understanding about orthotics and see how they're used and how they're how what a good orthotic looks like and what a poor orthotic looks like, and to understand all that. So we'll be covering all that in the course. I think it's in Melbourne on June the 7th, and it'll be back in Sydney on June the 21st, and then up in the Gold Coast on July the 12th. So that's a little plug for my courses. But going back to the question that I just asked you, we talked about some of the opportunities. What do you see as some of the challenges in the next 5 years? Like, what do you think? Do you see any kind of dangers that we're falling into as a profession that we need to avoid?
Oh, I don't know. I think the challenges are probably going to be whatever happens to the financial world and people
Right.
being able to afford osteopathic care. Um,
You
but
mentioned the need of obviously the skill of the palpatory skill for the osteopath, and how that really gives them a unique point of difference. Do you see a movement within the healthcare space in terms of removing the hands-on, making things very exercise-based, very kind of like, you mentioned like earlier on the podcast about the elbow and you were working with the physios and like, well, we'll just do the elbow, and like
mm,
breaking the body part into bits. This is the elbow, this is the knee, this is the hip, you've got a weak glute here, a weak multifidus there. That kind of thinking creeping into our profession. Do you think that's something that we need to be on the lookout for, or are you kind of just do you see that as a non-issue?
um, I see it as a non-issue for myself personally. For osteopathy, yeah, I think there's a lot of different sort of minds coming through that are probably a little bit more protocol based, a little bit more like let's stick to the evidence and um which, I think there's a place for that. But I think it's missing a lot of creativity and going back to, what makes osteopathy osteopathy. I think it is a an art and it's the art of science. And I think if we lost our creative thinking
Mm,
and just went to protocols, then I think that would be a big loss. And I think the kind of thought process behind that, I think, are probably well-meaning. And I think that they work very well for some spaces. Like I had a shoulder surgery a few years ago, and the physio sort of work and the rehab work that I got from that would have been very protocol, and it was wonderful. And I was a very good patient. I did all my exercises, but it was the osteopathic treatments that I got during doing those protocols that really helped me put my whole body back together after having such a big surgery.
mm,
Because it wasn't just my shoulder I had to rehab, it was my whole system and my
mm,
whole being and I think if we forget that people are a whole being and we don't treat that whole being, then and move more into this kind of like, well, that's the evidence, this is the protocol, that's what we're telling. It's like, yeah, great, you will get better range of motion, you will rehabilitate that really well, but there'll be a lot of the person that will be missed. Um, and I think and people don't know how good that sort of treatment can be. I think any osteopath who works like that, you'll get a patient come in and they're like, "Oh, I didn't know that you
mhm.
guys did this. It's good." And like, "What is this?" It's really special work. So, yeah, I think if we lost that kind of a little bit more creativity within osteopathy and that sort of approach, that would be a little bit yeah, a bit sad, wouldn't it?
So you're holding up the osteopathic rationale as being something that really defines us as a profession, and for us to hold on to that.
Yeah, maybe so. Yeah.
Yeah, right. On that note, I think it's a good place to end our conversation. I want to thank you for joining me this evening. Stay on the line with me, and we'll have a little chat. But for everyone else, thank you for tuning into the episode, and I'll see you on the next one. Have a good night.
Thank you.